For a terminally failing dentition, their options are to remove all the teeth, provide a full arch implant-supported prosthesis, which is screwed in, non-removable, a removable prosthesis where there's implants placed and that prosthesis is removed and taken out every night. The benefit of that is having the implants placed. If they're placed, the bone is stable and the bone is no longer going to resorb. For the patient looking to upgrade from a removable, they no longer want to take that removable prosthesis out of their mouth, and they're looking for something much stronger that doesn't chip or break, they can always upgrade to a zirconia full arch screw retained prosthesis. The zirconia material is the Cadillac of the materials. It's not porous, it doesn't trap odors, it doesn't break, and it doesn't chip. For those patients who are seeking a full arch solution, I would encourage them to contact our office, schedule a consultation where we can sit down and custom tailor a treatment plan that is specifically designed for you.